you're done with it. But of course, critical overflows is something that we don't want to have. So here's a look at the system. It starts out with the first month there. Essentially, the ward is empty, so it's sort of charging up, as it were, and so you have patients coming in 3.1 per day, as it were, and the ward builds up in terms of what's going on with it. And the first month is kind of like a, it's a initial period type of month. But after the first month, pretty much the system has hit steady state, and what we see is that it's behaving quite well in the sense that we are at that 36 level, so in general the ward is full. There are occasions when we go beyond, but we don't have any critical overflows. We're sort of operating, I would guess, the way that the hospital would like to operate, which is that, it's fully at capacity. Occasionally it goes a little bit above, occasionally it might go a little bit below. The figure on the bottom essentially summarizes what happens on a weekly basis for 52 weeks, and we see a distribution of bed usage on a weekly level. So there are different ways in which we can look at this, and they don't actually show exactly the same data because we're averaging over a week, and we're coming up with a number for a week, or we're doing it over a day, and all these are different ways of looking at the data, and sometimes you will lose a detail like, patient hasn't gone out when another one comes in, and that sort of a thing, which you would see on a more fine level. But nonetheless, it gives you some sense of what's going on, and we actually even go so far as to give you a table of it. Again, the first month we have a mean value which is quite low, but after the first month we have a mean value for bed usage, which is it's sort of close to the 36 level, which is what we imagine